This is Jimmy Koo. I'm the one of the two co-president with IBM Quarter Century Club, and so nice to see so many of you signing up to this seminar. So we have maybe about 110 people so far on the call. So since our speaker Keith Nabb is on a tight schedule, so we're not gonna.
No, I didn't.
Oh. We're not gonna wait much. We're just gonna go ahead and start. So I just want to let people know is that when we had our, since you guys received these letters from IBM since September, we have been getting a lot of calls. And during our fall picnic on September 22nd, many of our attendees expressed anxiety and the nervousness. And so back then we have no idea who we can get. So fortunately, I got the name Keith from another partner of ours. And we had a Zoom meeting with the Keith Nabb from the AMS last Thursday, I think. And so we found out after talking with him for 1 hour, we said Keith is the guy. He has 28 years in this industry. He knows this stuff. He knows United Health plan, and because he worked with many school districts, like a Cobb County. I'm in the Cobb County. My wife. So I'm on the United Health. So just a few quick things is. This seminar or this webinar is being recorded, so Keith won't use much slides. He's just gonna talk to us based on the information I provided to him, based on the information he researched on the IBM website. And so let me see. I just wanna, again, as I mentioned in my email, Keith doing this basically to help us, and he's going to provide his unbiased opinion about the IBM. There's a true United Health plan, because he knows Medicare Advantage, he knows Medicare and VA, all that stuff. So he's just going to provide us unbiased, and then if you guys need his help, he will definitely, can help you. And also in the future, if you have a friend that needs help, if you like Keith's knowledge presentation, please don't forget to refer Keith to them. As I mentioned, Keith had a 28 years experience, and he's very, very active in the Gwinnett County. I also learned from my IBM Quarter Century Club. Keith is also very active, talk to DeKalb Senior Center folks. And so he just has a wealth of knowledge. And if you look at his resume, he has spoken on this topic probably more than 1,200 classes. So he's definitely a person with so much knowledge. And so I think without further ado, and I think Keith, I know we scheduled for 1 hour. If we need to stay 15 minutes or 30 minutes longer, hopefully you can accommodate our request. So like I said, we have there's about 178 people registered, including their spouse. We have about 260 people on this call. So thank you everyone for joining, and thank you so much, Keith and Samantha, for doing this session for us. So without further ado, Keith, it's all yours.
Thank you very much, Jimmy. I appreciate the opportunity to speak to everyone and hopefully not confuse anyone, help people to understand what's going on. But I want everybody to understand that I'm an unbiased participant. I don't work for United Healthcare. I don't work for IBM. And my agency is a full brokerage that brokers all of the carriers in Georgia. But I've been involved in state lobbying efforts, federal lobbying efforts, plan designs with different insurance companies as a broker advisor. So I've been doing this for a long time. And as a matter of fact, I was in the very first class ever given in Georgia in 2004 on Medicare Advantage with one of the large insurance companies. So A lot of changes have happened, and I understand what's going on and why IBM is doing this for you. I have a good understanding of the financial reasons, stock reasons, and other things. Real quick, Samantha, raise your hand and say hello.
Hello.
Samantha's my excellent assistant, production assistant. She is the person that has helped set all this up. She will be monitoring the chat box, but if Sam, if you could help Rhonda there, I think you're helping her with her problem, right?
Yes.
Okay, good. All right, so everyone, my company is Affordable Medicare Solutions. We're the largest Medicare planning agency. There's a lot of people out there. You'll see them at Walmart's and at CVS and all these places selling Medicare. That's not us. We enroll people in Medicare plans, of course, but we are Medicare managers. We help people to manage their transitions if they're moving from, Georgia to South Carolina to Florida, or they're leaving one county for another one, or they're getting sick and they're having to go to a care home. We help them manage their Medicare transitions. And we work with organizations like Hurley Elder Care, which is one of their partners, Jimmy, and also with lots of hospitals, social workers, other people at a high level, helping them to manage Medicare and to get correct information. So that's my job tonight, is to help you guys understand that. Jimmy, I'm going to put my screen on primarily and turn off everybody else's video, okay?
Okay, sounds good.
So everybody can see the things that I'm going to share. All right, so let's talk about, why is IBM doing this? Well, they've been forcing everybody to use Via Benefits, and Via Benefits has been the fiduciary to disperse this $2,000 or $3,000 a year that you might be eligible for through an HRA, a health reimbursement arrangement. Well, the law is that an HRA provider is supposed to reimburse you for your medical expenses under the IRS rules. Instead, Via Benefits was also acting as a broker, which means they were doing what my job is, and they were writing people plans and making commissions and earning that business in a really controlled fashion. So IBM has gone away from that model, and they are doing their own internal Medicare Advantage program. And I'll show you the details on it at a very high level, actually, and are then dispersing the credits for some of the HRA through that program, depending on what you choose, or they're massively improving the plan, the enhanced option, with that subsidy money. So they're actually spending it on your behalf to make a really, really rich benefit plan. So I'm very familiar with all of the plans that Via Benefits has been writing for you, such as Medicare supplements, such as Kaiser Permanente, Aetna, Humana, United Healthcare, HMOs, PPOs, Medicare savings accounts, drug plans, all of those things my agency handles. So I know the plans that you have enrolled in, but IBM is going to say now, hey, you can keep if you like your plan, you can keep it, but we're not going to give you money towards those plans because we're now housing that money in a new benefit structure. We're going to give you two options, and we're going to give you that money in a couple of different ways. So we're going to go over that tonight, but I want to encourage you to look at the chat box. The chat box is very, very important, because in the chat box has my contact information. But one of the things there after that information is our YouTube channel. So I think we were having some people join tonight that are not IBM retirees. They're just looking for general information about Medicare. Well, this class that I'm giving tonight, this discussion, is not the same as a Medicare class where I teach people about Medicare soup to nuts, from A to B to C to D. I have that on our YouTube channel. I teach that at hospitals and senior centers and at online classes. So we recorded those and put those in our YouTube channel. So you can see it in the chat box. If you don't know where the chat box is, go to the bottom of your screen and click on the chat button, and you can see the chat box. It'll pop up on the right-hand side of your screen. The next thing in the chat box is the IBM Retiree Benefit Hotline. I am not going to have all the answers because IBM has not given all the answers at their website or on the educational materials. They say in those materials at certain points, call the benefits hotline for your specific situation. For example, looking up your drugs, making sure, are my drugs covered by United Healthcare? You don't want to get onto a plan and find out that your $1,000 a month drug is not covered. So you need to make sure that you use that benefit hotline to do the final analysis that I cannot do for you. I can't do that. Okay. So, and there's also going to be other information placed in there. Samantha is watching for your questions and she will be answering those. I won't be monitoring the chat box. Samantha will be doing that. We also have an email to contact us, which is info@amsplans.com. So let's move forward. I think we have quite a few people that have joined in, and we're going to talk in general about what is going on, and I'm going to share my screen. But this is what's happening. IBM put out bids to all the major companies, probably to Aetna, Humana, Anthem, Cigna, and United Healthcare. Well, United Healthcare has been the leader in these retiree benefit programs. In Georgia, they have been the leader in the teacher's retirement called State Health Benefit Plan. And it's been very popular and it's a very flexible option. Your option blows away the state health benefit option for professors and teachers and retirees from the university system. This plan that you're given is way better than the United Healthcare plan that the state health benefit retirees receive. I know that because I know both plans, a much better benefit, very similar, but a higher level. So let's talk about this, the benefits, and I'll share my screen so that we can talk about the benefit highlights. And let me get that pulled up. Make sure I've got the right one. There it is. No, can you tell me, Sam, answer this. If you can see where it says benefit highlights, IBM effective January 1st, 2023 to December 31st, 2023. Is that what shows on the screen for everybody?
Yes, I can see that.
Okay, good. So everybody, I've got multiple screens that I work on, so I want to make sure that I'm sharing the right one. The new plan that they're offering is two options. The primary option is called the Enhanced Plan, and the secondary option is called the Essential Plan. Let me first describe the Enhanced Plan. No deductible. It has a combined in or out of network benefit, maximum out of pocket of your spending, $750 maximum. That does not include prescription drugs. That is for your medical care. Now, if you're receiving cancer treatments or injectable treatments, insulin that is done through a pump, for example, that will include those things that are medical infusions, but not prescriptions that you're picking up at the pharmacy. On this Enhanced Plan, it's $5 to go to the primary care doctor, in or out of network. Specialist is $30. This is a very normal plan. You can do virtual visits for free if you'll use their Amwell or Doctor on Demand or Teledoc, or you can use your own doctor and see your doctor on a telehealth visit or virtual conference visit for $5. Preventive care services are free. Inpatient hospital care. This is an amazing benefit. $250 maximum charge per stay. Medical benefits, skilled nursing, the first 20 days are free. After that, $50 copay per day. That is a very good benefit. And this is really important. The United Healthcare plan covers unlimited days in the skilled nursing facility per benefit period, unlimited, whereas Medicare has a 100-day limit. I will be honest with you that very few people need 100 days of skilled nursing, but it's pretty amazing that they say it's unlimited on that. Outpatient surgery, you need a new hip, you need a new knee, you need a cataract surgery. Your surgical charges are $100 copay, and that's for your doctor and the facility. Might not be for your lens under your cataract service, but still $100 copay is a great deal. I broke my ankle and I had a $7,500 deductible. I would have much rather had a $100 copay for that broken ankle. This is a great benefit. Outpatient rehabilitations, very good deal. All of these things, CT scans and MRIs, only $20. That's a great deal. Lab services, $0 copay, etc. There's a lot of things there. On this plan, they do include dental, vision, and hearing aid coverage, as well as over-the-counter medical items. They give you $1,000 for dental care, $500 for hearing aid care, and they give you care of $40 per quarter for over-the-counter medical items like vitamins or allergy medicines or NyQuil or Band-Aids or feminine products or adult incontinence products, you get a $40 credit that you get to spend, which is every quarter of the year. So that would be $160 a year of free stuff that Medicare does not cover. They also provide meals to your home. If you go to the hospital and spend the night in the hospital, a true inpatient stay, they'll bring up to 28 meals, and they'll also provide 24 one-way rides of transportation, 8 hours of non-medical in-home personal care. These are all things that Medicare does not mandate or cover. Okay, so this is an advantage. This is why this is called Medicare Advantage, because it has these additional innovations. It's got a lot of extra things, including a gym membership that a lot of you might already have on your current plans. Well, this plan also provides the same or very similar gym membership. So it's a very robust plan. The prescription drugs are also robust with 0 copay on generics, $8 copay on regular generics, 0 on preferred. But watch this at the bottom here. It says right here that you can spend $7,400 a year on your drugs. That is the normal Medicare drug benefit. So there is no improvement here. I believe on the teacher's retirement, they do have an improvement on this, but not here. But the government is improving this benefit in 2025, that this $7,400 drug risk for your pocket, out of your pocket, is going to become $2,000. So they didn't improve it here, but the government is mandating an improvement in 2025. That's the new bill that President Biden passed, called the Inflation Reduction Act, or the Climate Change Bill, or the Medicare Improvement Bill. It has multiple names. But that bill does take care of this high risk under drugs. Okay. There also is a lot of help under this plan for insulin dependent diabetics. Insulin dependent diabetics get their insulin for no more than $35 per month. And that is for people who are doing injectable insulin. I don't know if that, if that applies to people who are using insulin pumps on their belt. But if it's on their belt, it would count towards the $750 annual maximum, and you're going to be okay there anyway. So this is a very good plan under the enhanced option. And I'm going to teach you how to compare this to other options. But let's go back up and talk about the essential plan. The essential plan is more of a basic Medicare Advantage program that is available in the basic market that I put my normal clients on. Okay, my normal clients don't get a subsidy from the government, but they get really nice Medicare Advantage PPO options available to them. I've got hundreds of them available in Georgia. Really nice. And the typical Advantage plan in the open market is somewhere between $4,000 to $8,000 risk. Well, the essential plan has a $5,000 risk if you got sick. Still no deductible, but this is a compilation or consolidation of all the little copays you'll pay, like $10 to the doctor, $40 to the specialist. Be aware that these numbers are not deductibles. They are a consolidation of all of your little copays. So instead of getting your hospital care for $250 per stay under the essential plan, you're going to have to pay for 5 days, the first 5 days. So now you're all of a sudden spending $1,300 or $1,400, excuse me, for that hospital stay. And then on the skilled nursing, instead of being $50 a day after the first 20, you're paying $125 a day for the next 40 days. That's a big increase. And then things like surgery, doctor visits, mental health, everything has higher copays. Well, the reason that they do that on this essential plan, they still have the gym membership, still have the dental, vision, and hearing. But the reason they do that is for, let me change my screen. And Sam, help me out here. Did my screen change where it now shows this one-time transition credit and enhanced versus essential?
Yes.
Okay, good. Thank you. Thank you very much. So if you can see, under the enhanced plan, they're not giving you any money towards your HRA because they have already invested that money on your behalf in giving you a higher level of coverage. The enhanced coverage, they bought down the costs for you by spending your HRA dollars. Well, some people say, I don't want them to do that for me. I want to get my HRA dollars. And they say, okay, that's fine. We're going to give you $1,300. under the essential plan up to $1,300. Some people will get zero depending on these categories, but every single person gets $300 a year, which is $25 a month applied to their Part B premium of their Social Security charges. Social Security charges you, whether you're getting a Social Security check or not, they're charging you for your Part B premium, which this year is $170 per month. Next year, it's about $165. So they're going to give you a $25 credit. So that $165 will go down to $140. So that $300 is not money you can grab into your hand. It's applied to your Social Security premium charge, okay? Because you cannot have the essential plan unless you have A and B of Medicare, hospital and outpatient B. So they're going to throw that $300 towards your B charges, your B premium, okay? Now, there is a one-time transition credit. And if you read the brochures, it'll talk about this. As long as you enroll by December 16th of 2022, you'll receive this one-time transition credit depending on your category, okay? So your category is very important and you want to get that money and it'll go into an HRA, and they're very clear about in the educational brochure on when that'll be paid out in January, I believe, and it'll show that. And the administration, it shows that the HRA is not going to be managed by VIA anymore. It's going to be transitioned to Optum, which is a United Healthcare company. They're going to handle that for IBM, which is better for you. That's better to get away from the VIA benefits, of course. So a lot of you are using VIA benefits, and I know a lot of you have expressed a tremendous amount of frustration with the VIA service model, and it is very lacking in some regards. I've heard. I've never experienced it personally. I've had a lot of clients that have left the VIA model out of frustration. So just be aware, all the plans that VIA does handle for people, we handle at my office also. So let's talk about some rules and talk about Medicare supplements versus Medicare Advantage. So I want to share another screen, and it's an educational piece that I put together for my clients. And I have to find it first real quick. I'll pull it up. There we go. And share this with you. Because there's a big question under Medicare of what is the difference between original Medicare versus this new modernized Medicare that IBM is pushing. Plus, a lot of people already have bought this modernized Medicare Advantage programs from VIA benefits. So just think about it this way. This is the easiest way to capture this subject matter. When you have original Medicare, you can prepay, this word prepay is written right there, for your medical care. Sam, please confirm with me I'm sharing with the right screen again.
Yes, you're showing original versus modernized.
Thank you. And under modernized Medicare, it's pay as you go when you need care. Well, the IBM model is kind of in between these two. But if you're doing a classic normal consumer buying Medicare, when you buy original Medicare, you sign up for original Medicare and do not use the new modern system, that's totally fine. Half of my clients, we have thousands of clients, over 5,000 clients, use original Medicare with what is called a Medicare supplement. It is a miniature little insurance policy, extremely effective, been around since the 1970s, and it fills in the coverage gaps of Medicare, but it makes no decisions on your care. Medicare makes all your decisions under traditional Medicare, and the supplement is not asked to pay the rest of your bills. It is instructed and required to pay the rest of your bills. It gets no decision-making at all. It doesn't talk to your doctors, doesn't talk to your hospitals. This Medigap plan pays second to Medicare, but then you have to add a drug plan to your Medigap coverage if you're doing traditional Medicare. This is the biggest thing if you are under traditional Medicare that you should review every year during the annual enrollment period, which is what we're in right now from October 15th to December 7th. So it ends on December 7th. If you're not going to participate in the IBM program and you're doing normal Medicare, you need to make your decisions before December 7th to make sure you have the right drug plan. And this is super crucial because of the new laws that have been passed and the new rules that are being added to fix these Medicare drug programs. But now watch this one right here. You can see any provider who accepts Medicare under original Medicare. Well, United Healthcare told you 99.9% of U.S. providers are able to be seen under the United Healthcare program. Well, let's make sure we qualify that statement. You can only see doctors who are willing to see you. If a doctor says my practice is full, I'm not taking any new Medicare patients. Yeah, they might be able to see you, but they're not going to see you. Okay, so you do always have to make sure: are you accepting new patients? Can you see me? Can I use my plan? Under regular Medicare, the question is just, do you take Medicare? And under United Healthcare, it's, are you in my United Healthcare network, or are you accepting Medicare outside of the network? So you have to make sure and be very careful. Under normal Medicare Advantage, you have all sorts of different networks. Some are very restrictive, like HMOs, but regular Medicare is super flexible, just not internationally, of course, flexible throughout the United States and U.S. territories. But watch this next comment right here. 100% coverage. You go into the hospital under a Medicare supplement. Under most supplements, the hospital is free. The skilled nursing is free. That's rehabilitation for free. Some of the Medicare supplements might have a small deductible next year of $226, but that's no big deal. It's still virtually 100% coverage. And you have to pay a premium. Under a Medicare supplement, you're going to pay between $150 to $250, maybe more per month. So if it's $250, that's $3,000 a year. Husband and wife, that's $6,000. So there is a cost. So there's no such thing as a free lunch. Remember, at the very top of the page, it says you can pay now or you can pay later. There is no such thing as a free lunch, but United Healthcare has created a happy medium between these two sides by giving you flexibility and subsidizing the choice. So they're trying to mitigate the differences between original Medicare and modernized Medicare. They're never going to mitigate every difference. There's always pros and cons, but they are trying to mitigate most of the differences. And I will give them credit that they have done a pretty good job with the enhanced program of pretty much mitigating the difference between original Medicare and modernized Medicare. I know that there's a guy, a blogger, that blogs on this subject. I'm not going to mention his name or his pen name, but you guys might subscribe to his blog. He puts it out there for the group, and he's highly critical of modernized Medicare and highly supportive of original Medicare. He even calls Medicare Advantage Medicare Disadvantage, as though there were no innovations under modernized Medicare, that it's all some evil cabal. And that's just not true. Remember, original Medicare does not provide dental, vision, or hearing aid coverage, does not provide at-home care, except in very limited therapy circumstances, like dressing wounds and a couple of other things. Original Medicare does not provide eye care for glasses and routine eye exams. Original Medicare does not provide transportation services beyond ambulance services. Original Medicare does not provide international travel coverage. Original Medicare does not do a lot of things. And the reason the government started doing the Medicare Advantage program in 2005 was purposefully to privatize a section of Medicare to get innovation happening, because the government was very bad at innovation. I'm not going to say that Medicare Advantage is great all the time. Original Medicare for sure is not great all the time. There's always a balance. There's a pro and con. So when you read some of these New York Times articles, or you read or see a video from Democracy Now!, which is a very highly biased organization towards socialized medicine, you read those things, you have to condition yourself to understand that there are people that support government-only healthcare, and then there are people that say, no, we need to modernize government services and privatize them and give people choices. You get the chance to make your own choice. That's what's cool. You're not in Canada, you're not in France, you're not in the United Kingdom. You actually get to make a choice. So feel blessed, but you need to make an educated choice. You need to make sure that you understand the differences and aren't lied to. Don't buy a plan just because it gives you free hearing aids or some $500 credit towards buying hearing aids. You got to make sure that your doctors are covered. You got to make sure your drugs are covered. You got to make sure that it's going to meet your needs. But are you making a lifetime decision? No. And if anybody tells you you're making a lifetime decision, they're wrong. You're making a decision for next year, and there are rules about that decision. So we're going to go over those rules, and IBM has given you one of those rules in their brochure, but I'm going to show you a few more of those, okay? And I'm going to share my screen, and I'm going to ask my production assistant, Samantha, to make sure that I'm not making a boo-boo, make sure that I'm sharing the right screen here, okay? And Samantha, please put this link to this choosing a Medigap policy for our website. Put it in the chat box, please, because everybody needs to download this, okay? They should download this because it's a free guide from the federal government. It gets updated every year. So this is the 2022 guide, and this explains your consumer rights on how to buy not a Medicare Advantage plan, but how to buy a Medicare supplement, and when are you guaranteed that plan? When is it guaranteed to you? So we've talked a little bit about the teacher's retirement here in Georgia, and I have people that call me and say, Keith, I have United Healthcare teacher's retirement program here in Georgia, and they tell me that if I leave the teacher's retirement, I can never get it back. And I'm like, okay, well, why are you going to leave? And they're like, because I want to have a Medigap policy. I want to have a standard Medicare supplement. It's also nicknamed Medigap. The government uses both terms interchangeably. And so people will leave their retiree benefit and say, no, I want to go do traditional Medicare. I want to have the purest, cleanest, longest running solution for myself and my spouse. So this thing tells you your rights to buy a Medigap policy and how to buy it. I'm going to skip down to page 22. See if it'll help me skip right there. And under page 22, this is your right to buy a Medigap policy under Medigap guaranteed issue rights. This means when a Medicare supplement plan cannot ask you health questions, okay? So let's say United Healthcare or IBM stops offering their Medicare Plan Advantage option, their Medicare Advantage plan option. Or you move out of their service area. Well, it sounds like this option they're offering is in every county of the United States. I don't know if it's in Puerto Rico or Guam, but let's say you move to an area where it is not available. You are guaranteed then a Medigap plan that's sold by any state, in your state by any insurance company. Okay, so that's important. Another thing is if you have original Medicare and you have this employer retiree option, such as the teacher's retirement, and they leave that, then we have 63 days to give them a Medicare supplement to them with no health questions. And then there's another option that if people should download this book, that the IBM has told you about this trial right option right here. They put it in the educational brochure and in another piece for you to read. It's very, very important. Let's say you've always been on a Medicare supplement. You bought it through Via Benefits. You've always been on your supplement. You're like, you know what? I do want to go to use that enhanced option from IBM. I want to give it a shot. It sounds like a pretty cool plan. My wife and I will save $4,000 on our premiums. I'll have no more than a $750 out-of-pocket maximum each. I'm willing to take that bet. Well, you're protected by federal law. If this is the first time you've ever tried a Medicare Advantage option and you're dropping your Medigap policy, you have 11 months and 30 days, so less than 1 year, 11 months and 30 days to raise your hand and say, I want my Medicare supplement back with no penalties. Excuse me. That is written in stone. This has always been this way since 2005. The government put this rule in place because they didn't want people to have a fear of going and trying out the new plans. They wanted to protect consumers, okay? And in certain circumstances, they also give people an extra 12 months. But in general, you would want to make sure that you raised your hand during that first year and say, you know what? don't like this enhanced plan from United Healthcare and IBM. I want to go back to my Medicare supplement plan, and I want it back the first of next month. It is required that they give it back to you under federal law. If your supplement company says, well, I'm sorry, we don't sell that plan anymore, you're still protected. You get to pick any plan by any insurance company available, depending on the category, any insurance company in your state. You're completely protected. Do not worry. Okay. And we'll take questions about this at the end. But I wanted everybody to know they can download this right from my website. Also at my website, you can see all sorts of educational materials, such as that flyer on the original versus modernized Medicare. We have a ton of informational pieces, such as how to build your Medicare account, how to do your own drug reviews, just a lot of information in there. If you have friends that are losing employer coverage, they're retiring from a non-IBM from another job, we've got information on how to help them to transition to Medicare. Lots of great information, really, really robust information at our website. Okay. Now, where are we on time? We're at 7 o'clock. So we've already done 34 minutes. And I promised Jimmy that I was going to spend about 34 minutes talking, 35 minutes, and then turn this over to our questions that were submitted in the spreadsheet that was submitted ahead of time. However, I do want to go ahead and look at the questions that were added in here. And I want to answer Gail's question, okay? Gail had a question about, what about underwriting going from enhanced back to a supplement within a year? There are no health questions if that's the first time you've ever tried out a Medicare supplement. However, that's one rule. Another rule is if you just decide to bow out of the United Healthcare Employee Retirement Program and lose your retiree coverage, then that's another guarantee moment where we can also put you on a Medicare supplement with no health questions. Okay. What's the monthly cost for these programs? We have a question from Ted Kirk. It shows on this chart. Let me share my chart and make sure everybody can see it. To answer Ted's question, this was given to you. It says that your premium for the enhanced is $0 for the first category. And then it starts to have premiums depending on if you're a retiree with the survivor benefit, which a lot of you took the survivor benefit. So you might have a $27 premium. Surviving spouses have a slightly higher premium. And then eligible for coverage with no IBM subsidy, they have to pay $131 a month. Well, look at this. If you take this $131 a month, which means they are not a IBM retiree with subsidy, you take $131 a month, 50 times 12, and that is $1,578. That is what IBM is applying to this monthly benefit, or this enhanced plan benefit. It's about $1,600 to buy down your coverage and make it better. Well, if you're not eligible for subsidy, you're going to have to pay that $131. That's a few people, I think. But most people are going to be 0 or 27 on the enhanced plan. Everybody, every single person that chooses the essential plan is a 0 premium. Now, remember, 0 premium means on the plan. It doesn't mean that your Medicare premium is 0. You still have to pay your Medicare Part B premium. Your Medicare Part B premium next year is $164.90. So basically $165. You always have to pay that. If you're a high income earner, you actually have to pay even more than that. If you have a family income of more than $194,000 a year, including your required minimum distributions and other income, or if you're an individual with $97,000 a year of income or more, you're going to pay more for your Medicare premiums. You're not going to pay any more for your IBM premiums. Those are not based upon your income. Just Medicare Part B premiums are based upon your income. And it also applies to the drug program. So you'll not only pay more for your Part B, but then they sneak in another charge and you have to pay more for your drug coverage. Sorry, talk to your congressman. It's a backdoor tax to tax high income earners. Okay. Make sure we got everybody admitted. All right, there we go. All right, so let me look at some other questions. And then a good question from Steve to everybody. Are there options for non-Medicare spouses. There are not, under the IBM thing that I am seeing, and I'm sorry, you're going to have to talk to the IBM benefit counselors, but there are plenty of options in the open market, plenty of options that we handle under the Affordable Care Act or Obamacare, where we help people that are what we call our trailing spouses. A trailing spouse means one spouse is in Medicare, age 65 and older, and another spouse might be, 55 years old. What is he or she going to do? Well, we put them on the Affordable Care Act plans and give them coverage until they qualify for Medicare. Then when they qualify for Medicare and get Part A and Part B, they should then immediately qualify for the IBM spousal benefit. Talk to your IBM helpline counselor about that. It doesn't look for any of the things that I read that there was anything for people under age 65, but we can help you with that. No problem, nationwide. Okay. This gentleman, Greg, says he's living in New York and he's turning 65 next May. Can he still get this plan? Talk to the IBM benefit counselors. I think as long as you're a retiree under your retiree qualification, once you receive Part A and Part B, you'll be qualified for these enhanced or essential benefits. That's your golden ticket, is getting the A and B of Medicare, which you can apply for 3 months before turning 65. Okay. All right. So let me see other questions. Steve asks if Samantha will be sending out our website. Our website is listed there, amsplans.com. And then it says, why is it Plan N? Mr. Butram asks, why is it Plan N on any list that I've shown? So let's talk about that. That's a great question, Mr. Butram. Let me pull that up for you and we'll share that. Bear with me and I'll pull it up and we will talk about Medicare supplements. Okay. Let me pull that up. And I will teach you about Plan N and other Medicare supplements, which IBM does not subsidize anymore. They're not going to subsidize that. Where is that? Okay, so let me share my screen and we will talk about that question. In Georgia and nationwide, but in Georgia, the three primary plans that people look at for buying a Medicare supplement, and this is a bird's eye view, but the three main plans are called Plan F, which is 100% coverage. Only people that can buy Plan F for the rest of their lives are people that turned 65 before 2020. Plan G is what most people are choosing. Plan G is the highest level of coverage. It has a small deductible. Next year, this deductible is going down by $7. And a few people, about 5% of the market, have been buying Plan N. I helped a gentleman this week with Plan N, as a matter of fact. But Plan N does not provide 100% coverage. It provides a slightly lower premium, and you lose a benefit, and you have to pay $20 to go see the doctor, all doctors, and $50 for your emergency room visits. But let me talk about a benefit that some people have asked under the spreadsheet that's on this chart here. So I want to highlight this. There are all different levels of Medicare plans. Don't get cross-eyed looking at this. Plan F, Plan G, and Plan N are the primary ones. So N is on the last column. And one thing that N loses is a feature called Part B excess charges. Plan N loses this. Plan G and Plan F have it. That means if you go to a Medicare provider who says we don't accept Medicare's base rates and we're going to charge excess charges like MD Anderson or Cleveland Clinic or some of those other places, Plan G will pay that 15% extra. Plan N does not. So a lot of people that buy Medicare supplements are wanting to buy this excess charge feature, and Plan N does not provide that. Plan F, G, and N do all provide international travel coverage up to $50,000, where you pay 20% and the plan pays 80%. So that, I hope that answered your question, Mr. Butram. If not, you can download this flyer from our website. All right, let's watch our time. Okay, so the gentleman asks, my wife and I are on the state health benefit plan. Please compare with the IBM plan. The IBM enhanced plan is much better than the state health benefit program. For this little subset of people, the state health benefit plan isn't the same United Healthcare PPO, but your out-of-pocket maximum is $3,500 under the zero premium option, whereas the enhanced benefit from IBM is only $750. The IBM enhanced benefit is better than the state health benefit. You need to talk to state health benefit though, because if you exit from there, you may not ever be able to go back, and that's probably the case. But that's all right. The IBM plan is a better plan anyway. All right. Donna Strong asked the question, if you decide to go back to Medigap after 12 months, is there medical underwriting? It depends on the circumstance, but it depends on the state also. But in Georgia, yes, there are medical questions after the 12 months under many circumstances. But if you are going to leave the IBM retiree plan in permanence, you might be on the IBM plan for 4 or 5 years and decide to leave it, then you will not have health questions at that point. If you're on a regular Medicare Advantage program, like Aetna or Humana or Cigna or Kaiser, and you decide to leave that plan, not IBM's plan, but you decide to leave a normal Medicare Advantage program and go to a Medicare supplement, yes, you're going to have health questions. That is correct. Not too bad. I wrote an 84-year-old and an 81-year-old today on new Medicare supplements. The questions weren't too bad. And one of them had prostate cancer history and one of them had pacemaker in, and they still are going to be accepted on their new plan. Let's see other questions. Sam, help me out if I missed any questions on the chat before I go to the spreadsheet.
Yes, I have wrote down a few questions that I received.
Okay.
One question is, if I switch back to original Medicare and the supplemental plan, will I lose my guaranteed issue rights even if I'm on the IBM plan for a few years?
No, I just answered that question. Yeah. So that'll be leaving the retiree program and you'd be guaranteed into a Medicare supplement. Certain ones, not everyone, depending on your age, you'd be guaranteed to F or G generally. So that I do that with teachers all the time, where the teachers will leave the state health benefit plan on purpose to get a Medicare supplement, and they will not answer any health questions. I do that a dozen times a year for those teachers retirees.
I'm not sure if you answered this one yet, but someone asked, is there a percentage that is not covered for chemo or radiation therapy?
No. Let me read that for you. I will read it straight off the plan. So the way that it works for chemo and radiation is that once you meet your $750 out-of-pocket maximum under the enhanced plan, you have 100% coverage. Okay. So once you meet this, and you'll meet the $750 right away, then you'll have 100% coverage on your chemo and radiation and immunotherapy and infusion therapy. All that'll be 100% covered. And the reason I know that is because the IBM plan has to cover everything that Medicare covers as a floor. It can only increase the benefits. It can't reduce and cut out things. It can only increase, like adding dental, vision, or hearing, or over-the-counter medical items, or home care assistance, meals, etc. Okay. Let me answer Rochelle's question. Rochelle had a question that was on the chat box, and it says, so if I have a United supplement, this is totally different than the IBM United-based offering. Absolutely, positively. The point of the talk is that original Medicare with a Medicare supplement is not supported by IBM anymore. It was through Via Benefits. It's not going to be supported anymore. You can keep that option, and it's a wonderful option. But if you go to the IBM enhanced option, you will need to cancel your Medicare supplement. And so during that first 12 months, you could easily just reach back and grab your supplement if you want it back. It's super simple during the first 12 months. There is no network when you have a Medicare supplement. Medicare is in charge. When you're under the IBM plan, there is a network, but they also allow you to go see any doctor that takes Medicare that's willing to see you. I want to answer the question here from Alvin. Alvin said, Keith, you had said IBM had gotten a better deal from United Healthcare. Is why they picked them. It seems to me the IBM will no longer pay the couple $1,000 subsidy. So probably there's a real reason that they are decommitting their subsidy. Now, I explained pretty clearly that IBM has transferred your subsidy into buying down your risk on the enhanced plan. So I don't know. I mean, maybe they should give you another $500 or something. I don't know. You can talk to them about that. But they bought it down by about $1,600 to give that enhanced plan a $750 risk versus a normal plan at $5,000 or $6,000. So they didn't steal your money. They just applied it to that benefit. Now, if you're not participating with any IBM program, essential or enhanced, yeah, you're not going to get that benefit. And they're very clear about that. They're saying we're making the benefit eligible only through these two new options. Unless, let's talk about the exceptions. In your brochures, it says very clearly that if you are in, exceptions will apply if you are enrolled in Kaiser Permanente HMO, Medicaid, TRICARE, VA benefits, and those people who are living abroad. So they're not going to discriminate against those people. They do not tell me what that means. They say you need to call the benefit hotline, helpline, and they will tell you. I have a feeling, my guess, is they're going to give you $1,500 or $1,300 credit if you're under Medicaid or Kaiser or VA or TRICARE. I don't know that for sure, but that's my gut is telling me, because they're making a clear exception to help those people out and not discriminate against veterans, not discriminate against the poor, and not discriminate against people who have a insulated system like Kaiser, where it's really difficult to leave Kaiser because you have to change all your doctors. It's extraordinarily difficult to leave that program. So they're making exceptions for people who are using the VA. And of course, if you're living abroad, you're not going to use Medicare anyway. So that would be a discriminatory thing to not give them some sort of help as a retiree. Call the benefit helpline for that, okay? I hope that answered Alvin's question. No, the IBM Enhanced and Essential Plan do not cover excess charges. No Medicare Advantage program covers excess charges. They cover Medicare charges. What Medicare states is the Medicare fee schedule. Any other questions I missed, Sam, on the chat box?
This is kind of just a general question. Someone sent me a message asking, would silver sneakers be not covered? Is that not covered under United?
Great question. United Healthcare used to subscribe to the Silver Sneakers program for their Advantage plans and for their supplement plans. They stopped doing that nationwide and created their own in-house program called Renew Active. Renew Active is a very similar copycat, I'll use the word copycat program of Silver Sneakers. Sometimes the same gyms in your area will be on both Renew Active and Silver Sneakers. Not all the time, but oftentimes that's the case. And sometimes some YMCAs will be on one program and not on another program. So the Renew Active program is a very robust gym membership program and also an at-home fitness program if you don't like to go to the gym. They'll encourage you to work out at home with, I think they have videos, home activity kits they'll send you with pedometers and other things to help you out. Now, Ramesh Bakshi asked a question in the chat box. Says, I travel 6 months per year. Can I go to any doctor, any hospital, anywhere in the United States who takes Medicare? Yes, but international travel is different. So regular Medicare does not cover international. The United Healthcare program, I believe, I'll just double check it. It does, I believe I read yesterday, cover worldwide coverage. Let me make double sure on that. Let me just put a search feature real quick. Hold on. I want to cover their worldwide benefit. There we go. Under United Healthcare, let me share the screen so you can see this. United Healthcare does, if you're a traveler, Sam, can they see my screen that says emergency care?
Yes.
See where it says $75 copay worldwide? They can't say worldwide unless it's true, okay? So they do provide you that. I do not know the volume of that worldwide coverage. You'd have to talk to United Healthcare on their benefit helpline, and they may not even know it. I believe it's probably limited to $50,000 or $100,000. So if you're a worldwide international traveler, you probably want to buy travel insurance to supplement either the enhanced or essential plan or your Medicare supplement. Don't rely on them to provide you full international travel coverage. Obviously, it's different to go to Egypt versus going to Germany as far as your healthcare, but you make your own decisions on that. We help people with international travel coverage all the time. We have it on our website, and we do a great job with that, including travel coverage that has COVID covered also. All right, let's see here. I've got some other questions in the chat box. I'm not going to explain the excess charges anymore. We had Ed Thompson. Ed Thompson asked a question, says, no new funding will be given for the HRA, but what about FHA dollars that were converted to HRA? Are they still available under the enhanced plan, or will they be used to fund the enhanced plan? So in that educational brochure, let me share that screen. I think this will be the answer to the question. They sent you you can download off their website. Sam, can you see this IBM website right here?
Yes, I can.
Okay. Where it says coverage and benefits, you can download this from the IBM participant website. It says educational brochure, but I'm changing the screen here. This is page 7 of that educational brochure. And it explains to you in that brochure about if you are eligible, what happens. And then also that retiree benefits that had an FHA that was converted to an HRA at their Medicare effective date will continue to have access to their HRA balance provided they enrolled in one of the IBM Group Medicare Advantage options. So you have to do that before December 16th. But it also says, for more information, go to your retireeuhc.com/IBM and also call the benefit helpline. But they do a good job of explaining this in the educational brochure. I hope that answered your question on there, okay? Let me stop my share. Yes, under Kathy had a question about mail order pricing. United Healthcare only considers their mail order their preferred pharmacy. So they're going to give you the best deals under the mail order. And let me get, see so that, let me see here. Kathy DeReuter says, is there any downside to this program? Yeah, there's always pros and cons. You know, a pro of original Medicare is that you probably have fewer pre-authorizations and a little more access to skilled nursing facilities, or if you're living in an assisted living home, they're probably going to be more happy that you have original Medicare. It just makes their life for their staff a little bit easier, not massively easier, but a little bit easier. And under the Advantage plan, under the Enhanced plan, the enhancements of having dental, vision, hearing aid, over-the-counter medical items, at-home assistance, meal delivery, all sorts of stuff. There's a huge upside that original Medicare does not provide. Thurman has a question. It says, if I stay with my Aetna Medicare Advantage plan, the one that I have currently, how do I compare this plan with IBM's plan? The IBM Enhanced plan is better than the Aetna Medicare Advantage programs. You can do that through Medicare.gov. You can call my office. If we have time, we could do that for you, but you can go to AetnaMedicare.com and put in your zip code and look at the different Aetna Medicare plans. But I know the Aetna Medicare plans and I offer those and I take care of those. And any of the people here that if they wanted to stay on their Aetna plan, they can make me their agent of record, no problem, just by calling Aetna, saying I want Keith to be my agent. But I'm going to tell you that the IBM Enhanced plan, the Enhanced plan is better than the Aetna Medicare Advantage plan. Maybe not the Essential plan, but remember the Essential plan is giving you $1,300 plus $300 for the highest level of reimbursement. That's another $1,600. It's pretty hard to top that. That's a pretty good benefit. All right. Gerard or Jerd, Jay Jerd says he's been getting ads from Aetna United Healthcare. The IBM plan, you need to study that one before you look at any advertisement. All right, so let's go to the spreadsheet and see if I can answer a few more questions in the next 10 minutes. Yes, the question here was from Dave Tharp. Do you need to pay each time you have a physical training session? Yes, but once you meet your $750 out-of-pocket maximum on the Enhanced, those physical training sessions will be free. I don't know the answer to Dennis Peltovany's question. He says, if my spouse stays with her current plan, United Healthcare through the teacher's retirement, can she be added to the IBM plan in the future? Well, I don't know how old your spouse is, so I can't answer this question because if she's under 65 and she gets Medicare, that'll be a qualifying event to join the IBM plan. If she's already over 65, you need to call the IBM retiree program. And I believe she can, at the end of each year, choose whether or not to be on the teacher's retirement or on your retiree program. The question is, she could probably never go back to the teacher's retirement. I believe the IBM plan is a little bit more flexible from what I've heard from people who sat through the training classes. Have already told me that there was some flexibility about changing from the essential plan to the enhanced plan and some other things that IBM has made it a little bit more flexible than what I hear from the teacher's retirement. I already answered that question. Let me see here. Okay, if you're retired military with TRICARE for life, you need to talk to the IBM helpline. I think you'll be fine. I think you'll actually get some money. You need to talk to them and probably keep your TRICARE for life, okay? Let's see here. The question was, what if we go to a doctor outside the network? Just ask your doctor if they're willing to bill United Healthcare. And if they are, then you're fine. He's going to get paid the same exact Medicare fees. It's not a problem. Question is, if I stay with my current Medicare plan, which is Medicare plus a supplemental plan F, I will lose the IBM reimbursement. If 1 year from today, I change my thoughts and decide to convert to the IBM Advantage plan, will I be able to have the IBM reimbursement reactivated? Well, it depends. You need to talk to the IBM on that, but my understanding is yes, you could join in the future. That one-time transition bonus is not going to be eligible for you. So some people are getting a one-time transition bonus. You won't get that, and you won't get a reimbursement activated if you're under the enhanced plan because the subsidy is built into the plan benefit. If you choose the essential plan, then you could get up to $1,600 in reimbursements. But do talk to the IBM helpline for that. Is the new IBM offering as good as our Medicare supplement plans? Darn close. I'm going to say it's pretty close. If I have a Medigap plan, can the new insurance company be used worldwide? I've already answered that question. Let's see here. Dwayne Neal says, I do not understand what Medicare Part D is. Do we need to belong? You're not required to pick up Medicare Part D if you're doing this on your own. That is the drug program for Medicare. It's independent drug cards that you sign up for through Medicare or through my agency or via benefits. Do we need to belong? You're not required to. If you join the IBM enhanced or essential option, yes, you're forced to have a drug plan because they're built into the plan design. But people outside of the IBM plan design can decide if they want a drug benefit or not. And if you go without a drug benefit and you're not a veteran with VA or TRICARE, then you would build up a penalty for not having a drug plan. So be very careful about that. That penalty can add up to be quite a bit for the future when you do sign up for one. Let me see if I've got other questions here that I can answer in the next couple of minutes. What is the criteria that determines which option you can sign up for, enhanced or essential? Well, there's no criteria. There's no health questions. You just pick it and determine yourself what level of risk and what bonuses you want to have. It's your choice. There's no health questions at all. How do we know if our current physicians will accept this new Medicare Advantage plan without any data from IBM? You do have access through the links. You can see the United Healthcare PPO network. You can also through the links that they've given you on your brochures and on the benefit website, you can look up your drugs, or you can actually call the helpline and they'll help you look up your drugs. So all that data is available. You can look that up. It's public information on the United Healthcare PPO network anyway. That's public. But you have the drug information is through your website. Will Kaiser members still have the HRA in 2023? You need to call and ask about the exception that they talk about. Just ask about that. Next question here. Does the maximum out-of-pocket expense in the enhanced plan include dental, drugs, and eye care costs? No, it does not. The $750 out-of-pocket maximum includes medical care, and dental care is not considered medical care. Drugs that are from the pharmacy are not considered under that $750, and eye care costs for glasses and regular eye exams are not considered medical care. If you get a cataract removed or have detached retina or floaters in your eye, that is medical expense, and that will be covered. Let's see here. Does my spouse need to be on the same plan that I select? I believe, yes, that is correct. I believe that is a household decision. Check with IBM on that, but I believe it is there. Drug questions, you need to go to the drug list to look up drugs to see if they're covered. We have a couple questions about that. And What is the risk using an Advantage plan? I've already explained that. There's out-of-pocket differences and access to care differences, but the enhanced plan and regular Medicare are very, very similar. Not perfectly the same, of course. There are differences, of course. Let me see here. I've addressed most of these questions. Yeah, every year you can change your IBM plan choice. They've said that in the earlier meetings that are being given. There's a recorded meeting that keeps being replayed that you can watch that was under our chat box that you can go to the IBM and sign up for those meetings. All right, we've gone over time here, but I think I've answered everything on the spreadsheet that I think. Let me make sure, everybody. Okay, there's a specific question about a Medtronic monitor and pacemaker. You would need to talk to United Healthcare about that. That's through Kaiser, so you need to talk to Kaiser also. But I cannot answer the question about medical equipment. Sorry about that. I cannot answer that. If they don't have the Medtronic, they may have another version that's on their list. Let's see here. Last question. Can you suggest a timeline for a married couple to transition to Medicare from IBM employee-based benefit program? Well, it depends on when you turn 65. So you want to do it 3 months prior to turning 65 and read your IBM retiree rules. And once you get to Medicare Part A and Part B, you should be immediately eligible for the date on your Medicare card to start your IBM Retiree Advantage program, either essential or enhanced. All right, so I'm going to close down the spreadsheet. Sam, do we have, or Samantha, do we have any other questions under the chat box?
Yes, we did have a couple that came in.
Okay.
I think some of them you have already answered a couple.
Gene had an interesting comment here. He says, I believe that spouses can be on a different plans with this new IBM program. You know, Gene, I didn't read that in the book, and make sure that that's not about, a surviving spouse kind of situation. So I'm going to hedge my bet, and Gene may be correct here. So let's read in there, ask the IBM retiree helpline about spouses being on different plans. There may be some exceptions if one spouse is a veteran or one spouse has TRICARE. So you want to make sure that they're not giving you general information that really only applies to exceptions. Okay, good. And then Mike McGuire says the webinar that Gene is correct. You know, back it up by asking that question again with them, because under most retiree programs that I deal with, under most, the husband and wife are on the same program. All right, very good. Do we have any other questions? One new message. Let's see. You're welcome, Mahan. You're welcome for the presentation. All right, so I hope I didn't give anybody a headache. I hope I gave everybody good general information in an unbiased fashion.
Thank you, Kate.
My pleasure. Remember that my agency can handle all the different Medicare programs. So if you have a friend that's confused about Medicare, have them call my office. If you say, I don't want to do this IBM program, I want to go to regular Medicare with a supplement, call my office. You don't need to call Via Benefits anymore. They're not going to give you the same service because their contract has been canceled from IBM. So call my office. We'll be happy to help you. And no charge. Our services are free, just like Via. We get paid through the system. No charge for all of our services.
Keith, thank you so much for spending more than an hour, talking to our user. Listening to your presentation, you are like a encyclopedia, Medicare health insurance. So we are just so thankful for, having your knowledge, your experience, talking to our user. And one thing I want to mention to my, a few things. I was able to talk with Keith last week. As you guys can see, within a short week, he was able to spend time research on the IBM website and understanding about IBM United Health plan. So he just a guy so willing to help. So if you guys ever need his assistance, please contact him. Then also I want to mention to IBMers, IBM does provide education seminars from October 17th to November 4th. I did listen to one today, and it was pretty interesting. There's about over 500 people on the call. The only thing is the United Health presentation was a recorded thing, unlike a Keith, it's all live. But the session does, IBM benefit person, United Health does answer questions. And so that's one thing I want to mention to our members. There's a IBM education seminar. And let me see, we're going to make this recording, we're going to make that available. I will send that to everybody on this call.
Jimmy, email them also that the list of all the virtual classes that was it Gary or somebody sent over, all that list. You should email that to everybody.
Yeah, that's the letters most IBMer has received with that. Yeah. So I know today at the peak of our session, now counting you and Samantha, we had about 149 people. So I know it's been slowing down some. So I want to thank you everybody for for joining us. And if you need Keith help, so Keith, they can just contact you directly, right?
Yeah, on the contact information that was there, it's info@AMS Plans, or they can call our office, which is 770-945-5261.
Wonderful. So I think that's it. And thank you again, Keith, Samantha, for talking to our QCC members and friends. And thank you to IBMers. And I hope this session provides you good information and the resource. So I think that's it. So Keith, thanks again. Thank you, everybody.
All right. Thanks, everyone. All right, have a great day.